Let's go after things that affect a lot of people, where there's a big need, and there isn't anything around that works very well.
The days of trial and error, where we just treat every patient and wait to see what happens, are over.
If you don't actually have the guts to take risks, you're not going to make it in this industry.
Risk-taking is essential to innovation, and innovation is live or die in the pharmaceutical industry.
The molecules that we're testing, that we've designed, have never been tested before, have never been invented. No one's ever seen them.
You have to be the eternal optimist. You have to believe that the next molecule that you make is going to be the right one.
Our job is to transform that scientific idea into an actual new product.
Can we help patients? Can we improve their lives? Is this drug, is this target going to treat the disease?
Understanding how to achieve much greater benefits for patients is a real possibility now.
This is where the new medicines that are going to make a difference for patients are being created right from the beginning.
The chance to really make a difference in the next 20 years is going to be even greater than it has been in the last 20.
We're now at this incredible place where we're gathering information and data so quickly that we're unraveling what I think is the great unknown, which is the blueprint to life.
This is where the story molecule to medicine starts. You first have to understand the disease, understand what has gone wrong in the disease, what's causing it, and really ultimately identify the target.
We can generate an antibody in the lab that recognizes that particular protein that we want to have less of around in cancer.
The analogy that I like to use is when you're flying on a plane. There is a map of the airline's routes. That map is always really complicated. And what we try to do in biological systems is also to map out that network. And for us to then figure out what are the most important nodes. Just like if you wanted to shut down a particular airline, there are certain hubs that if you shut down, you would shut down that network. And we're trying to do the same thing in cancer biology, is figure out what are the most important nodes to antagonize them and then see whether or not there's any benefit.
Solving problems is key to being a scientist, being able to take things apart and figure out what the issues are and then be able to build solutions.
So a research scientist in GRED could have a great idea for a therapeutic, but if we can't manufacture it within our group, then we can't scale it up to meet the demand that would be required of us in a clinical setting.
GRED is developing all these really neat molecules that have all these different characteristics that behave differently, that we've had to develop new techniques to study them, and it's getting to be very, very difficult to formulate these, to keep them stable and to be able to deliver them to the patients. They're really good there, but that means we actually have to be better.
I think biomarkers really are changing modern medicine by really making clinical oncology in particular much more science-driven and science-focused, much more based on what is the underlying biology, the science of that patient's cancer, and then trying to translate that to clinical benefit rather than just hoping that a patient's going to respond to a chemotherapy without any real mechanistic basis for that hope.
This is the right thing to do for patients. When you understand disease, and you think about these segments of disease, you can't make medicines any other way. If you understand the drivers of a subset of cancers, you can't treat all of the breast cancers the same as these cancers. This is the way biology is set up. This is how medicine will progress.
You can have any number of wonderful drugs, but if they all sit in the lab, they're not helping anybody. Being able to get them out there to the patients who really need them, that is what we do.
When patients have access to their drug for the first time and have a benefit that hasn't been described before, that is the most amazing moment in what we do.